Can we do it?
Hi everyone, welcome back to In Between Sessions, Beyond the Walls of the Therapy Office. I'm your host Samantha Hill, and I'm so glad you're listening today. Our goal with this show is to break down mental health topics in a way that's approachable, relatable, and informative. Whether you're navigating your own journey, supporting someone you care about, or you're curious about how our minds work, we want to create a space where open discussion about mental health can be made while breaking stigmas. Today's episode, we're going to be talking about burnout, compassion fatigue, and overall managing chronic stress. So first, burnout has become almost a unwanted kind of sidekick for us. We're living in a world where the demands just keep piling up: work, school, relationship, family responsibilities, and home life. And sometimes it just feels like that never-ending to-do list keeps growing faster and faster, and it can be hard to keep up with. And over time, those pressures can really start to take a toll. Burnout doesn't usually hit you all at once. It builds slowly. It happens when stress stacks up over time, starts draining you emotionally, mentally, and physically. You might be juggling too many responsibilities. For example, work, parenting, caregiving, school. No matter how hard you try, you just feel wiped out. Something important to know here is that burnout actually isn't a medical diagnosis. A lot of experts believe burnout often overlaps or is influenced by other mental health conditions, especially depression. The term burnout actually goes back to 1970s, and it was coined by a psychologist named Herbert Freudenberger, who noticed it in doctors and nurses and people typically with caregiving roles who were basically just sacrificing themselves for others until they had nothing left. Today we use that term much broadly because burnout can affect anyone in any profession. So we're briefly going to go over the signs of burnout and knowing the signs around them, because once you can catch it, you can prevent yourself from having a total crash. When these signs are ignored or pushed aside, they can lead to even more emotional and physical and mental distress. One big sign of burnout is deep exhaustion, and it's not the kind of exhaustion where you can take a long, deep slumber and wake up and feel refreshed. It's the type of exhaustion that even after a long, deep slumber, you still wake up and you just can't keep going. It's heavy, ongoing, draining, and it doesn't seem to lift. Another sign is losing interest in things that once brought you joy. For example, that could be spending time with friends, having a hobby. Things that once brought you joy suddenly feel like chores, and it can be hard to keep up with or commit to. You might notice that you also might become cynical towards the work that you're doing. What once brought you joy, purpose, or motivation now feels empty or meaningless. Over time, this can turn into feelings of detachment, unmotivation, or emotionally numb, especially when it comes to work or school. And to pair along with that, there's often a decline in performance too. Concentration gets harder, creativity disappears, and even basic tasks feel overwhelming. For our high achievers or our overachievers, this can be especially tough because it can really shake our confidence. And then there's irritability. Little things start getting under your skin that would have never bothered you before. So with all of those things and all of those early signs and symptoms, it's important to be aware of them so you can keep up with your physical health, but also your mental health. Today we're joined by counselor Londen Denny, who's going to be talking more about compassion fatigue, job burnout, and overall mental health.
All right. So this is a new episode, and we have Londen Denny here, a licensed clinical social worker associate who is practicing as a counselor, mental health therapist here at Wilmington Mental Health. So welcome to the show.
Thank you for having me.
Thank you for coming and participating. So today's conversation is on mainly what traditionally is known as burnout, but in clinical terms, we refer sometimes as compassion fatigue or chronic stress disorder. We have multiple names for that depending on the situation, circumstances, or how it presents. But basically, we're going to cover some of these topics together. So
Sounds good.
I guess we can start with primarily how people experience it. in what way we during therapy we identify it, and also when during the interventions that we use, what are some of the things that we use to help people, some of the methods and techniques that are applied during sessions to help alleviate these symptoms and conditions. But before we get started with that, I want to give you a little bit of an introduction on what are the populations that we usually target when it comes to burnout and compassion fatigue. So we like to think that this is something that affects everybody, whether you're working or not, whether you are in a stressful environment or not. Even people in remote regions have manifested some level of stress, and to a certain degree, we can consider that stress to be able to present chronically or even acutely, right? So 3 months plus or 6 months plus of a condition or symptom that affects the person and that can impair them in a way that they become numbed or become unable to complete tasks and perform. So let's use the colloquial way of calling this problem as I feel that you are getting stuck, burned out, and so on and so forth. But before, let's talk about the symptoms. How do they manifest? So, based on your own experience, London, what are some of the things that you hear from your patients, things that people present?
I think common things are a lot of fatigue, even though they've gotten plenty of rest at night, they're eating well, but they're still just tired during the day, a lot of lethargy, even if there's no medical conditions or anything like that. So they don't have an explanation for it, if that makes sense.
Mm-hmm.
And so they're like, okay, I'm doing all the things I need to do physically, but mentally I don't feel like I have it in me anymore.
Correct. And these are people who probably have experienced this their entire life, and it's just part of who they are, and sometimes this is part of their life, basically the things they do, and who they are, and it's hard for them to identify that because it's just who they are, and sometimes people say that they feel that they have a cloud on top of them, like on their head constantly, and those who are able to say I know how it feels, they feel like you say fatigued. At the beginning of the day they might feel a little energized, but as the day goes, that energy depletes. Now, I know that you're familiar with how this presents in mental health conditions like ADHD, or autism, or people who have some type of milder to moderate condition like depression or anxiety, right? Where they feel their mind is fogging, clogged, and it's hard for them to concentrate and think. Have you heard of anything extraordinary, any symptom that you wouldn't think that that's present in someone who is fatigued?
That's a good question. Something extraordinary.
Mm-hmm.
Well, you kind of mentioned compassion fatigue, so just not caring. It's in individuals who they have a lot of care, a lot of compassion, and so that feels weird to them to not care anymore. It's like there's something wrong with me because I care so much about everyone all the time,
Mm-hmm.
and now I could not care less about anything at all.
Yeah, I like that. I wasn't even thinking about that. It's actually true. People are compassionate naturally when they choose these fields. The mental health, the healthcare fields, and it might feel unnatural to not be there for your patient, not care. Although this might be something that builds up over time. There are other things that I was considering, such as medical conditions. Given that your body is somehow vulnerable and your immune system is compromised, people who experience stress, it is known to manifest medical conditions. People who develop rashes, hives, they get sick, or out of a sudden they have symptoms very similar to what presents with people who have COVID, and or following an immune disease, and added to that the chronic level of that condition, person might experience that longer than 6 months, basically. Um, I think the other thing about symptoms that present is once you identify that during session, what to do about it, right? So, in your own experience, what are some things that you have done with this population?
Well, once we identify that it is burnout or compassion fatigue, usually it's focusing more on self care, what they're doing for themselves, taking more
Hmm.
time for them. Because if they're used to constantly giving time to others, then, like, okay, if that's increasing, then we need to also increase self care.
Right.
Because we like to think that that's something that's secondary. If we have time, like, then we'll get to it if we can. But that has to be just as important, especially when we're going through burnout. So increasing that is usually the point where I start.
Definitely. We like to think that as a counselor, we want to see the patient come in, tell us these are the things that are presenting. We kind of create lists of things that we need to work with them on or that they need to work on, and then prioritize. And if one of them is, lifestyles, the things they're doing, addressing those things and letting them know that they might have to make some changes in those areas. And some people can get scared with, what do you mean I have to change, going to work, and work 12 hours a day. That's my lifestyle. That's what I do. I'm a doctor. I cannot afford not doing that. But, in my own experience, I have had patients coming to me because their employer requires it. They got suspended or they have gotten in trouble because they changed their personality, their approach to things. They made mistakes. They have done things that have cost them potentially their jobs. And they're coming to us, or to me in this case, asking for solutions, for help. And change might not be feasible because that's what they do. That's who they are. That's what they're used to do. Um, what do you think change might look like in general?
I think a main thing that I focus on, like, they can't make the change of working less. So it's just time management overall. So, like, looking at the entire week and actually planning out, making time. If they have a set schedule for work, then setting a schedule for self care as well and time for themselves,
Hmm.
and making that just as much a priority as all their other responsibilities. Because we like to think, there's not enough time in the week for all the things that I have to do. But really, if we sit down and plan it out, there's plenty of time. We just have to use it to our best advantage.
Correct. And another term for that we use is time management or stress management, right? So we have anger management, stress management, life work balance. Those are terms that have been recently included in our vocabulary because people understand the need to find that balance between what they do at work, most of the time not bringing that work home, and when they can disconnect from work, they somehow switch to being at home mode and spend quality time with family, and being mindful of the things that you do. And that brings me to this new concept, or well, relatively new, which is mindfulness. What is that? What do you know about mindfulness?
We went over mindfulness very briefly in grad school, but my understanding is trying to take the time to think about what we're doing instead of just going through life.
Hmm.
Taking the time to enjoy a meal instead of just getting it down because you don't have time.
Hmm.
Taking time, like doing basic things like, showering, cleaning the house instead of just moving through life, but taking time to slow down and appreciate things, to think about, what does this meal actually taste like? What am the nutrients that I'm getting from this meal, the shower, the soap that you're using, how the water feels, and things like that. Just slowing down in life so that everything's not such a rush.
I like that because a few minutes ago I mentioned that people feel this cloud, this foggy brain, and how do you think clearly when your brain is not allowing to do that? You're numbed, right? You're sedated to a certain degree, and it feels like the need to be there, to be present, to be mindful, is in a way a solution to that problem. It's kind of like helping them clear their mind. Just think one thing at a time, or be here, be present, and disconnect from all that chaos. And research shows and demonstrates that the practice of mindfulness helps the brain declutter, clear some of that chaos and chaotic lifestyle that people experience. And teaching that in the during session is something that we make a priority of. Um, what does a traditional session with someone who is experiencing burnt out look like for you from the moment they start?
For me, a session, if they're experiencing burnout, first they usually want time to just kind of get it all out. All of the thoughts that they've been having
Hmm.
that they can't talk to maybe their spouse about or their kids or friends because they don't want them to worry about them. So they don't want to dump it onto them. And so I give them time in the beginning to kind of get all of that out. Everything that's worrying them, that's adding to the stress, adding to the burnout, things that they're thinking throughout the day. And then once I get them a chance to get that out. It's like, okay, where do we move from here? How do we take a step forward? Because I think it's important to give them that time to decompress, but not focusing on it entirely. Kind of, solution focused, which, okay, like we can acknowledge that there is a problem. That's definitely the case, or else you wouldn't be here. But not focusing so much on the problem to where they leave and it's like, okay, but now I don't know what to do. Like I got to talk about it, but I don't know where to move from here. And so I give them that chance to kind of speak their piece. And then we go into how do we make a change. And so then we talk about, small action steps that make a difference throughout the day, just small things that they can do for themselves. So if they have a busy job and, they only get an hour lunch break, it's like, okay, during the hour lunch break, are you doing something for that job? Or are you doing something for yourself, something for your kids? What is going on during that time? And so finding little times during the day that they can take for them and only for them. Not anything that's productive in any other way, but it's for them, something that they're getting from it to recharge that battery so that they can get through the rest of the day.
It's a very clear layout of how that session is expected to be, and what are some of the things that you do. I think that it's important for the people that don't know what will be done, what's to be done, to know how what to expect, and one of the target populations in my case is employees, right? People who are working, professionals who are working. That's why the compassion fatigue require not that it requires, but it's unfair that they are working with people, right?
Mm-hmm.
And people who work with people are usually healthcare providers, people who work in the social sciences, and these are people who are traditionally, interacting with tons of people. And yes, we might love to work with individuals, but there is a point where the stress coming from home, the financial stress, the life stressors that present, all these things that are bombarding you daily are getting in the middle of you being genuine, of being you know empathetic when you're interacting with these people. And that's when you start thinking, here's another person coming in, here's another person coming in. And it's more like, okay, come in, get out, rather than let's interact, let's be together, like, let's talk about what's going on and be genuinely empathetically involved in what is happening. That is what we consider compassion fatigue. And when a professional identifies that this is happening before they get suspended, before they get called to speak with their supervisors or directors, and before things get more complicated, we want to help these people. Here at Women to Mental Health, we like to think that we have a program dedicated to that population where we want to help people who are experiencing some degree of compassion fatigue, stress, or even chronic stress. And we invite this population to pay attention to those symptoms, the symptoms that are presenting, not only because they are presenting currently, but because they feel that they're about to present. The things are building up, and we wanna make a call to these people that are really really interested in having an outlet, a place where they can talk about these things, to come and visit us, to give us a call, and even if it is a consultation of what we can do here. It could be at the individual level, it could be at the corporate level. We can help this population definitely. Um, and we talked about mild cases, mild to moderate cases of compassion fatigue, but there are severe cases of compassion fatigue or chronic stress. There are many conditions in the DSM-5 that are listed to recognize that these symptoms, when they exist for too long, this problem is no longer a chronic problem. This is a severe problem that has passed the level of, oh, you take care of that yourself. Have you experienced any of those events here or incidents here when somebody comes with a severe case of compassion fatigue?
Um, I'm trying to think. I had a nurse as a client one time, and she was going through what I think was compassion fatigue. Had a lot going on with personal life and hadn't been a nurse for very long. And so her immediate thought was, there's something wrong with me. I should be able to give more. I shouldn't be so sad to go into work because I wanted this profession. This is what I've always wanted to do. This is what I went to school for. And so with that, it turned into major depression because instead of noticing, okay, it's just an an incorrect balance between work and life balance. It wasn't how it should be. Instead, she tried to give more to work, give more to people, and try to have kind of force the compassion that wasn't there. And so then that led to her having thoughts of there's something wrong with her, and that led her down to major depression. And so once we were able to move into treating the depression, we had to find a way to treat the compassion fatigue at the same time and burnout, which was difficult on both ends because just as bad as she wants to feel better, I want to help her in any way that I can too. But eventually we were able to get her the coping skills and the necessary changes to make, which not the ones that she wanted to make in the beginning because she wanted to continue working how she was and things. But ultimately she had to realize if I continue going how I am, I'm not going to be able to stay in this profession. It's just not possible. And so accepting the reality of that is what really drove her to make the changes necessary to get out of burnout, as well as addressing the depression.
All right, so thank you. I enjoy hearing that these situations do present during session and can be something that us counselors experience and there is this whole idea that we are here to help others, right? They come in, they dump their problems on us, and we are prepared to take these issues and somehow help them. And many times we are the victims here. We are the ones experiencing compassion fatigue. So is there anything you can say to other professionals out there who might be involved in the treatment of trauma, complicated cases, and what can be done to help them feel solutions to when they're experiencing a little bit of that burnout, to prevent burnout?
Yeah, that's a good question. I think taking care of yourself, knowing that this is a job and not who you are as a person, not taking that on as your identity, was a helpful thing for me. I got into burnout early on into working in the helping profession, and I think going into it, because we talked about burnout in grad school, and it was like, oh no, if this is the profession that's meant for you, you're not going to get that, like you're going to be fine. Mm-hmm. And that's just, it could not be further from the truth, because really being in this profession, you're here because you do care and you want to help, and that is what's going to drive you into that burnout. But I think preventing it is knowing that this isn't your identity. This is not the only only part of your identity that matters. Everything else still matters, and taking time for yourself outside of your job, outside of the profession, and doing things that matter to you, that bring you joy, to recharge that battery so that you do have it to give to your clients.
And it is contradicting because a part of you is thinking, I need to be able to give myself 100% to the patient that I'm seeing, but another part is saying you shouldn't. You have to be able to delineate a margin between how much you care about your patient and your own life, the things that you need to do at the end of the day, not carrying that with you everywhere. Because if you don't, that compassion, yes, you're being compassionate, you're being caring, you are a professional, you're ethically dedicating, devoting all yourself to that person, but you're human at the end of the day. And because you're human, you're vulnerable. You're going to be exposed to fatigue, to getting, overwhelmed with the amount of work that you're putting on that person. And eventually it's going to vicariously affect you. It's going to start hurting you. And protecting ourselves from that is something that's important. In our field, in the mental health and social worker field, there is this thing that we're not supposed to be practicing while impaired. You're not to be impaired when you are in front of a patient. And if you feel that you are affected, that you are getting burned out, it's unethical to work with a patient who, is coming to you and presenting problems when your mind is not there. So that's another population that we're targeting: counselors seeking counseling, which in my seem kind of productive. Why is my counselor seeing another counselor? But in reality, that's a very common thing in our field, because we need to protect ourselves. Our humanity, our capacity of being human requires that we work with the patient, but also that we work on ourselves. And, it's definitely something that we need to take into consideration.
Yeah, I think in grad school, one of the first things that they told us was that every therapist should have a therapist.
Mm-hmm.
And that's surprising, because I'm like, no, I should be able to just help myself once I learn these skills. But could not be further from the truth. And like you said, taking care of ourselves, that's how we make sure that we can continue taking care of our patients.
Yes, definitely. These are the topics that are important in our field, knowing that there are people out there that might be experiencing symptoms that might not necessarily qualify as a mental health condition, but they do come to us. We offer a program called Employee Assistance Program. We assist these people who are working for an employer that offers this program and the opportunity to get help without necessarily going through their insurance. And that, those who don't necessarily qualify for a mental health condition, but they do want to have an opportunity to talk to someone. Those are the people that experience mild cases of burnout. And we offer help here, whether that is through their employer, through EAP, through their insurance, or out of pocket. Give us a call. Let us know if we can help you. We will do an assessment. We will see to what extent one of our providers here can help, and potentially connect you to someone who will be able to offer solutions.